When the world gets weird and the bills get thick, you call on Clint and you feature Dick. One talks numbers, the other talks slick. Two dads, one mic, yeah, this could stick. Clint's crunching figures straight to the point. Dick's just here to laugh in the joint. It's the Clinterific Show. Featuring Dick. Dick's quick with a joke. Clint's got the math. Together they'll balance your checkbook and your laugh. They'll talk finance, fun, and fatherly fails with liquidity dreams and 401k tales. So grab your coffee, join us a ticket, the Clinterific Show, featuring Dick.
Controversial, inflammatory to get caught in the middle of
And welcome back to the Clinterific Show, featuring.
Oh, wait, which side am I on?
You're always on this.
You're in the middle for me.
Yeah, you're always on this side for what I'm recording. So,
are we doing a merge? Is this a Dragon Ball thing?
No, yeah, we're doing a Dragon Ball fusion thing. Yeah,
that would be the weirdest fusion ever.
It really would. Yep. So yeah, welcome back, and welcome our special guest this week is Kristen Borth. She is a longtime friend of me, myself. We have known each other since kindergarten, I think.
Forever.
Yeah. I was telling Ricky that we're like kind of awkward shirt tail relatives because we have the same cousin, but it's on the opposite side of the family. Yeah. So it's like we're not really related, but we're at some point kind of. So yeah.
It's weird.
Yeah, exactly.
You have to be there.
A Southern thing.
Yes,
I'm sure they do that down in Louisiana and Mississippi as well.
Oh, for sure, definitely. So yeah, Kristen is joining us, and we're gonna ask her some questions about her career and you know why she landed in the career that she is in, and we're gonna do a new segment as well this week. We're calling it the Hype Train. So we're trying to add a little bit of positivity to our podcast and talk about something that we're excited about. It doesn't have to be personal. It just has to be something that you are excited about that's happening someday soon. So we're going to talk about that. And then, hopefully Mr. Dick over here did his homework for the week and actually came up with a going deep topic.
You know I did. Going deep.
And that's how we'll wrap up. Yeah.
Absolutely.
So yeah, this is episode number 29 for us. So, Kristen, I know that we've talked a little bit about your career, and I've tried to explain at least some bullet points to Ricky, and I know I have slaughtered it horribly because I can understand a lot about most people's careers. You know, I could tell you most of what Ricky does, but yours is very specialized, and I'm horrible at it. So the only thing I've ever been able to connect dots on is that it's hospital and medical coding in some form or fashion, and I know that's probably the dumbest down version that there is. So would you care to elaborate that?
Sure. I don't do that, but that is in the grouping of what I do. So, you know, it works.
Okay.
Okay. So you're not alone. My husband, for probably the first 6 years of our marriage, didn't know what I did. He just said I helped hospitals. So
okay.
That's pretty much it. I have I have the most techie degree in healthcare that you can get, but I'm not techie. I mean, my husband had to set up Discord on my computer, so.
Yeah.
But, okay, so I have a bachelor's degree in health information management. What does that mean? Think medical records, medical coding, medical billing, regulatory compliance, privacy and security, those types of things.
Okay.
I have a master's in health informatics. So people, process, technology, all three of those are my expertise.
Okay, so I want to interrupt you for just a second because when you first told me that was what your master's was in, I'm not going to lie, I thought you were making up a word. I was like, yeah, she's in informatics. That's a thing. Yeah, I'm just gonna smile and nod because I don't want to look dumb and say that it isn't a word.
Yes, I made up my master's degree so I could sound more special.
Listen, you wouldn't be the first, I'm sure.
I'm sure I wouldn't. There's probably like a million celebrities out there that have done this, I'm sure.
Oh, yeah.
But yeah, so no, it is a real thing. And it's actually usually on the clinical side. So you usually have clinical informatics rather than just a broad spectrum health informatics. So what I do on a day-to-day basis actually has nothing to do with that. So I am the part owner and CEO of a national consulting company. Mm-hmm. And so really I help all of my consultants that do what I excelled at in college to do and help them get to where they need to go.
Okay. Now you're also a professor at, is it Riverside?
No, it's Cosumnes River College.
Oh,
so
okay.
Close, Clint.
Okay. I was close. I did my research, but I'm getting close to 40 and apparently my memory is just going down the toilet. So yeah. Okay. So you work as a Ricky,
I'm a tenured professor.
Okay.
I'm just going to say your batting average is really low right now.
It is. I feel terrible. So you, I read all of, I got on your LinkedIn and read through all of this stuff.
Wait, are you sure it was hers and not somebody else's?
No, I know it was because I confirmed 3 times. Now, it may have been an old profile or something like that. That's happened to me before.
No.
But yeah, so you are the CEO.
Yes.
And you're kind of the lead consultant for this company, and you also work as a professor. How many classes do you teach? Is it like just one class, or is it like a whole course curriculum?
I teach 5.
Oh wow!
Yeah,
okay.
I teach 5 and I run the program. So I took over the program in 2019, and from there we had a really low student profile. We only graduated 1 student that year, and I think it was last year we graduated like 40 students.
Wow.
So
interesting. Yeah. Okay.
Yeah.
So is it a growing field?
Mm-hmm. So yes, the thing is, so if you look us up online, like the Bureau of Statistics, Labor Statistics or whatever, it's boring. It's like, oh, they used to call us librarians. Oh, you're a medical record librarian. And I was like, oh, no, I'm not. No.
So you have one of those jobs that like when you start explaining what you do, that people get that look like,
oh yeah.
What?
They
the glaze over.
Dwellers. Yeah. They think of basement dwellers, people who like come up out of the depths like, oh, I'm here.
Yeah. You haven't seen the sun in a while, have you?
Exactly. Yeah. Exactly. They're like, whoa.
Yeah.
But we've actually changed a lot because as healthcare started morphing into more electronic versions, so you all probably have experienced this. You have kids. You go to a doctor's appointment. They're no longer writing things down on paper. And if they have paper, it's like a sticky note, right? But they're doing that all in the computer. And that is where my profession lives. So we have exploded.
Yeah.
And then you add in things like AI and, regulatory governance and compliance and all of the hacking. So privacy and security. That is all of my expertise right there. So you called out, Clint, the part that is not my expertise, but the other side of my profession.
Awesome.
But
okay, so I was at least half right.
You were half right. I can do it. Yeah. I can do it. I just don't do it.
I see. Okay. Yeah. Okay. So that kind of goes over the first question that I was going to ask, because it kind of gives me a general sense of what you do. So you teach. You've got 5 classes a week.
Yep.
And that's a full-time job. Like, because that's. 5 hours in class, right?
So you would think so. I'm gonna stop you right there because it makes me sound like I'm just like totally insane because I also have 3 kids and a husband and like projects outside of this that just
hobbies.
I don't know, tantalize
like
my
to do activities. Yeah.
But so my classes are all online. So I record all of my lectures. So my students can go and listen to my lectures. It's, most of my classes are 8 weeks, so they're not all running at the same time. I have 2 different groupings that happen. And so it's not something that I really ever thought I could do, was because it is 2 full-time jobs.
Right.
But it works out well because the school kind of runs in the background, really.
Okay.
Like I'm answering emails, I'm talking with students, but it's everything that I do on a day-to-day basis. So they're getting real life industry knowledge into what they're learning. So it kind of is married up really well.
Okay, so that does beg a question because we talk about all kinds of stuff and AI is the hot button thing right now, and you did bring that up. So here's my question. It's a 2-parter. So how do you feel about AI from an educator perspective on kids using it to help them with tests and answer questions and stuff like that? And then how do you feel about it from I've got an agent set up that does all my grading for me?
This is a complicated question because going in as a professor and teaching my students, I guide them into using AI, but I put little tiny nuggets where if you just try to copy my assignment in and be like, oh, give this out, it's gonna spit out some random stupid thing in the middle of the assignment. And all I have to do is search for it.
Okay.
And they would have had to have read really well. So 2 semesters ago, it was, I sit on pumpkins and, it literally comes out in their assignment and it just is hidden in there at the middle of a paragraph. I sit on pumpkins. And so they will copy that over and then I can tell if they did their whole assignment through AI or not. So that is how I have navigated that. What I do is I put in my assignments, use AI with this prompt. So have them write their paper. Now put your paper into AI and say, where are some areas that this paper is weak for me? And then it will point out areas that it's weak so that they can use that as a way to expand their knowledge. Or how do I make this more professional, which is usually the case because quite frankly, no one knows how to be professional anymore. Everyone's texting, emailing. It's weird. I don't know.
Yeah, it's very informal now.
Yeah, and this is one of the things I will admit that I love about AI. So I call it a data dump for myself. So what I do is I just start typing in Chat GPT or Gemini or something like that, and I just type out the most hateful, angry, swear-filled thing that I can get all the rage out.
Thoughts,
and hey, this is how I really feel. Now make this sound professional. And then just copy and paste that into the email.
I love those.
I feel so much better.
They always end up sounding so passive-aggressive and petty in the most polite way possible. This is delicious.
As per my previous email.
My previous email.
Yeah. There was just 400 expletives in the previous version that I just typed out.
Yeah.
So I really like what you said there about how you put in little Easter eggs for your students. I think that's really clever. I did see a clip of another teacher was talking about how he'll put little sentences and he'll change the font color so you don't see it. And his students will just copy and paste everything and slam it into Chat GPT or whatever without even looking at it. And then when they turn in their assignment, it randomly has the word Madagascar put in their assignment in a way that makes no sense because they didn't even proofread it after Chat GPT spit it out. I'm like, These are the people who are going to become our next doctors.
Yeah.
Listen, the world is going to be a real fun place whenever they get to running the world.
Going to be terrifying.
It is terrifying.
Yeah. Well, I mean, okay, so Clint, you asked me about the education side with AI.
Yeah.
You didn't ask me about the healthcare side with AI. So the healthcare side with AI is probably the scarier side.
Yeah.
You know, you have providers who are 60, 70 years old. They're just excited that they can no longer create their own summary. And so they're just copy and pasting it into ChatGPT. And then you're like, oh, wait a second, that's an actual breach. Like that is a federal problem. You've got to stop.
Wow. So you're talking about like somebody who's still in the workforce that's copying. Oh, interesting.
So think about like you go into like I would go into the doctor's office with Cooper and he documents everything, but he's just making bullet points. He's just like has a headache, stubbed his toe, whatever it is, right? So he's adding all these things in. Then he copies all those bullets and says, create me a summary. And at the end, copies that summary back in, but he just released all of that private information. Now, this isn't happening like all the time, but the thing that I think has me kind of on edge is that our providers are doing this. But then we just had, I mean, you guys probably heard about this, was, ChatGPT's 0 day, where ChatGPT, their new versions were training and they were working them through to see what they could do. They broke out of their training zone, got onto an internet server that they were not on internet. So they got into a server, got onto the internet, broke out of that, and then broke into another company and cannot tell you how they did it. They can't go back and retrace their steps to help you figure out how to fix it or what's going on. Like this is like real stuff that's coming down. So when I talk about like AI, I'm so for it. I am here for it. I think it's great, but I also am like,
that's horrifying. Yeah,
it is horrifying.
It is coming to life.
What's his name from the Terminator? John.
Yeah, what is it?
John Connor.
John Connor. I was gonna say John Carter. Yes, John Carter's dead. Like we've already had the timeline changed, and everything's different.
Yeah. So
they're already in control. I mean, yeah. Listen, it's like, okay, we've got the monsters in the government that are in control, or we've got the monsters in the computers.
Yeah. And they're all coming for you.
Exactly. Yeah. Oh man, that is interesting though, because it's so fascinating to me how these. I don't like to use this term because I feel like it's overused, but these boomers, basically anybody that's about 55 plus, they have no idea how to wrap their mind around this technology. I mean, I was having a conversation with my parents the other day about it because my mom, she got pretty sick she had a really bad stomach ulcer, and we had been trying to figure out for like a year what was going on, and she tried everything she could. She had gotten put on some kind of medication that was designed to be a pain reliever, but the problem is if you take it for an extended period of time, like 8 months, it turns into literal stomach ulcers. And so I told her, I was like, well, just download ChatGPT on your phone and just start, journaling everything that you're doing, and it'll start noticing patterns that you are not even thinking about. Yeah. But I'm also not thinking about it from a perspective of what happens when your doctor does that, because he just shared all of your information with the powers that be.
Yep.
Yeah.
And they're going to sell it to China and India and Saudi Arabia and everybody else.
Yeah.
Or just, let them take it, whether they sell it or not.
Yeah.
And
so how do you
hospital that I work at, they don't allow any kind of AI on their system for those reasons. Yeah, absolutely.
Are they sure they don't have AI?
Well,
yeah, that's
the problem, because like they use Microsoft products.
Yeah,
right?
we're not
So,
using any AI. Well, you know, ChatGPT is AI. That's AI.
Copilot, they're trying to force down everyone's throat like it's a
I know.
spoonful of sugar,
Yeah. Thanks a lot, Bill
Well,
Gates.
Well, that's the reason I ask. That's the reason I ask is because my company comes in and assesses hospitals, and their AI is called so many different things now. Yeah. And we know it as AI, but they have large language models that are built on all these other things, and a typical hospital administrator doesn't know what's in that fine print of the contract. And so we found in several of our clients that they all say, "Oh, we don't have AI," and then we get in there and we're looking at, we're like, "Actually, you have AI built into 2 of your tools."
Yeah,
and
they don't even know it.
And
wow.
They don't have policies on it. They don't have anything. And so, you would want to check in with them like, hey, check out the HTI, rules and regulations. Check out what HIPAA's just updated and saying. And then, of course, anything with ONC. But that's exactly what we do. And that's why we do that part, because most people don't know what they have.
Interesting.
So, yeah.
Now, I'm going to smile and nod because I'm going to pretend that I know exactly what all of those 3-letter abbreviations that you just gave were, but I have no clue.
They're the federal government.
Okay. Yeah,
this
okay.
is great because I'm understanding more of this, and when you talk about financial stuff, my eyes glaze over. And I go, yeah, okay, Clint. Yeah, exactly.
Right.
Yeah. So when Clint actually asked me to come on this and he was like, "We're going to talk about finances," I thought, what are we going to talk about?
No.
I don't even know.
No, this is more of a education, but it's more from a career perspective, because that's really what I'm curious about. Because and that was kind of one of the next questions that I wanted to ask you. So, obviously we've known each other for a significant portion of our lives. In high school, if you were to have asked me, like, hey, you know Kristen pretty well, what do you think she's going to be? It definitely would not have been this.
Well, what would it have been? I want to know.
That's an interesting question. So honestly,
gentlemen of the internet,
I could have. No, I seriously could have said something kind of in the maybe sales or marketing realm, possibly HR, which I guess to an extent is kind of an umbrella of part of what you do. But I would have leaned more towards that, because you have a very more of an outgoing personality. So I was like, okay, somebody who likes to talk to people and stuff like that. I would have assumed more of the sales and marketing side, definitely not the I'm going to sit here and dig into the data. You know what I mean?
It's true. Yeah, it's true. No. If you had asked me in high school what I was going to do, it wasn't going to be anything like this. Nothing. Mm-hmm. No one. I don't think anyone in high school would have been like, "Oh, Kristen, she is very smart and she's just going to, go all the way with her education and do whatever." No one, I don't think, would have said that. As a matter of fact, I even had a teacher that told me to depend on my looks at one point, because I wasn't really applying myself. Yes.
Okay.
So all of that to say, though, is that I would never have.
Wow. Well,
I'm super outgoing.
If it makes you feel any better, I always thought that you would be successful. I just had no idea what you were going to be successful in. So for whatever that was worth.
Okay. And that, I think that part of my personality is very weird for my education. So most people with my credentials, so my master's in health informatics, my bachelor's, and my RHIA, which is a registered health information administrator. And then I have a CHPS, which is a certified healthcare privacy and security specialist credential. So people who have those, they are not the people that are traveling all over and doing presentations and talking to people and going out and meeting people and walking through the hospital and they're in the cave. And so I am more unique. Now I think the profession is changing and growing as you get more people who are kind of like me, that you just really are interested in all of this, I'm going to say, nerdy stuff that you kind of like love the legal jargon. You're like, oh yeah, I get what that says. And it's like fun to read. And then you turn around and you're like, oh, hey, let's go to the, coffee shop and let's just sit and talk with everybody. Like I think there's more people like that now, but no, high school, no one would have pegged me for anything like this.
Okay. So why did you decide to go? Like, what was I took a class and I loved this, or did somebody recommend it to you?
No. Okay. So 50% of people on this call know me very well and know that I can have blonde moments. I wouldn't say that I'm like that blonde that you're like, oh, she's like a blonde. But there are moments where it's like, oh, there it is. And that was what happened. So I applied to 2 different programs. I applied to the health administrator program, and I also applied to the health information management program at Loma Linda.
Okay.
And I read both of them. I got accepted into both of them, and I was like, yes, here we go. And
now I could have seen you going into the health administration. That one, that clicks for me. I was like, yeah, that sounds like Kristen from what I knew her in high school.
Yeah. So I thought that I gave back my acceptance for saying, yes, I'm going into health administration. This is so fun. I'm so excited. And I left it at that. I just blindly followed everything that Loma Linda told me to do. And I got into class in my first semester or quarter. We were on quarters. I was like, listen, guys, we were, no joke, like 4 or 5 weeks in. I was like, listen, guys, I know that medical records are like super important. Worked in a hospital for a while. I get it. Why is that all we talk about? And my advisor smiled very kindly. I was like, hey, let's go to my office. I was like, okay. Didn't think anything of it still. We got in there and she's like, yeah, so you are in the health information management program. And I was like, oh, no, I said I didn't want to do this one. She was like, well, you're in it. And I was like, okay. She's like, just hang out for the quarter. If you really hate it, we can move you over. And I was like, yeah, but no, I don't want to. And she was like, well, just try it. I was like, okay. I mean, I'm in the classes. We were going on site to a clinic, and I was like, maybe this will really just excite me. So we got on site to the clinic, and the woman that came to meet me for my rotation was the epitome of what I never want to be, ever. Ever. She...
No personality, just it was a walking computer.
I wish that was the case.
Oh.
She walked out in okay, now mind you, this is a professional setting where you see patients on a day-to-day. She walked out. She walked out and she had the tightest jeans on I'd ever seen. So no joke, this woman had a camel toe. And her belly was hanging out with all her stretch marks.
Oh!
And she turned around and she had a back butt that was showing because her shirt was all hiked up. And I am there.
This is what I want to be.
Is there. And I turned to look at my classmates, who also did not look like that, by the way. And I was like... no, this is not going to work. And I walked in and I listened and stayed pretty much as far away from her as I possibly could because she smelled terrible. And I walked out and walked straight to my advisor's office. I was like, excuse me, no. And she was like, that was a bad example. I was like, no, it wasn't.
We're not all like that.
Example. It was terrible. It was absolutely terrible. But then I got home that night and I was like, okay, God, I'm just going to pray about this because it's going to take literally another year for me to get back into that program. And I did not want to waste another year. Mm-hmm. So I was like, Lord, just like show me what I'm supposed to do. So the rest of that quarter went by, and 2.5 weeks or 3 weeks before the quarter ended, we started talking about consulting. And I latched on, and I was like, oh my word, I can do this. I can do this. And I started enjoying all my classes. The next quarter, I was like super excited about it. And I started announcing to everybody that I was going to be a consultant, which to my professor's chagrin, I actually did become a consultant right out of school, but they all told me that was never going to happen.
Yeah.
You got to get experience, Kristen. I was like, I have experience. And obviously,
I got this degree. What do you mean?
Yeah. I'm like, what more experience do I need? I already met your girl. So, yeah, it was a whole thing. And, so there was my blonde moment that ended up being like my worst nightmare for a solid like 18 hours. I was like, oh my word.
Listen, that is an incredible story. I love that, because it's one of those things where it's like you when you look back on it, it's so amazing how your life ends up the way that it is. Because I don't know about Ricky, but when I went into college, I had no idea what I wanted to do. I was literally clueless. The only experience that I really had at that point, I had worked a construction job throughout high school. And I was like, well, I know construction at least to an extent. I'm going to go into construction management. I went to the community college for my first semester because I wasn't sure exactly where I wanted to end up. And if you don't know what program you're taking, you don't know where you're going to go. So I took my first semester. It was like a history class, and I think it was just Trig 101. Hated everything about trigonometry, and I'm taking this class and I'm looking at the core curriculum for this program because I was at the Northwest Arkansas Community College looking at that because it transfers to the University of Arkansas, and so I'm looking at this class though, and it's like trig, calculus, and I'm like, I hate math, and then I end up as a freaking accountant. Which is what's even funnier. Right. And so people are like, oh, you must love math. And I'm like, no. Most third graders can do the advanced math that I have to do on a regular basis. I add and subtract, and every once in a while I'll have to multiply, which is real crazy. But most of the stuff I do is in Excel, so...
And it does everything for you now.
Exactly. Yeah. With Copilot, I don't even have to think about Excel anymore. I just tell it what I wanted to do.
Nice.
But it's just funny that you kind of go through an experience where it's like, oh yeah, I accidentally accepted the wrong program, and based on how you're talking about this and all the conversations we've had in the past few years, you love everything about this career path that you've chosen.
Yeah, I do, which is why I'm still teaching, to be honest with you. The part for me about the teaching isn't okay. I love and hate my students. I shouldn't say that, but you love the aspect of
I worked in education. I totally understand what you mean.
Okay, there's something about I love that aha moment, and I wait for that aha moment. Mm-hmm. But getting to that aha moment is so painful. It's so painful. Mm-hmm. They're asking me questions. I'm like, that's in your book, and that's the dumbest question. But I can't say that because I'm your educator. So here we are. I'm explaining it to you again, and I don't know what to do. I can't help you anymore. It's just things like that are hard, but. There's something about this profession because I don't have to touch patients. I don't want to touch patients. I very much so enjoy helping you from afar. Yeah. But I know that everything that my team does, everything that we are doing to help the hospital, everything that we're supporting the hospitals with directly impacts the patient. And that to me is the best part. Knowing that a patient walked out that door and they didn't have a bill that was inaccurately coded. They didn't get charged way more than they were supposed to. They understand Medicare better than they ever have. Mm-hmm. That is what makes me so excited. Also, like I said, I'm the nerd who's like, what new regulation did they just put out so that we can see what the hospital has to do?
Yeah. It's funny how stuff like that happens. Like once you land in a career that you're actually passionate about, it's like, oh yeah, what's the new regulation? Did I just say that? Like, I feel like 15-year-old me would kick my ass.
Right? Exactly. Yeah. Oh, 15-year-old me would be like, wow.
Yeah, you are a dork.
Job on the planet. Like, what was wrong with you?
Yeah.
You wanted to do something so different than this. I don't even know what I wanted to do at 15. Probably like a veterinarian or something. Something that I would have thought would be like, oh, this is glamorous.
Yes.
But no.
Yeah.
Yeah.
Well, listen, me and Anna are co-running a animal shelter right now, and I can tell you there's nothing about being a veterinarian that is glamorous in any capacity. I could not do that. I mean, there's just so many things that happen that you have to make difficult decisions about dogs and stuff like that when they get sick and no, there's no glamour to be had there.
But I think when you're 15, you're like glamorizing it. You're like, I get to wear like the white coat and I get to say I'm Dr. Kristen. Ooh. That was why I started out pre-med, but I also hated that as well. I ditched that pretty quick too.
So when you started, did you start your freshman year in this program or was it something that you transferred into later?
Yeah, so I actually, this is a long tale, but I'm going to make it real short. So my first year in college, I changed my major twice. My second year in college, 3 times. And then my third year, I was like, I'm out of here. I'm going to go to my uncle's college, and I'm just going to graduate with my associate degree because I have no idea what I'm doing. So that's what I did. And then I got accepted to do speech pathology, which, hallelujah, I don't do that. I love everything a speech pathologist does, but I do not want to touch anybody's spit. I don't want to touch your face. So, so I actually got accepted into that program. I got accepted into that program and then found out that you just couldn't get your classes because it was a Cal State program. And the way that they had them set up was just terrible. You couldn't get your classes. And so I ditched that then. And that was where I was like flailing. I was like, I don't know what I'm doing. I'm going to be a loser. I'm going to go back to reunion. No joke. This went through my head. I'm going to go back to reunion. Everyone's going to be like, oh, I'm a nurse. I'm a doctor. I'm a whatever. And I would be like, I'm nothing. I don't know what I'm doing.
I'm homeless.
Yeah, exactly. I live with my parents still. Like literally, I was like, I can't do this. So that's what drove me to start looking outside the box. I knew I wanted to stay in healthcare, and I was working as a ward clerk in CNA, which is the least glamorous job on the planet, I think. Ooh. And I was working in the ER, and one of the doctors there said, you need to talk to my assistant. And I was like, I am not becoming your assistant. This is where my brain went. I was like, no. I will not be a doctor's assistant. This has weird ideals behind it. I'm not doing that.
Yeah.
And so he brought her in and she said, no, I have a degree, in business administration. And so I did an internship for 2 months, which I sucked at because I was like, this is stupid. You have me like filing papers. This is not anything. And so that's how I completely ended up at Loma Linda looking at totally different degrees.
Interesting. Okay. Yeah. So that kind of brings me to my next question, because as I'm looking at this from an accounting and finance perspective, one of the things that, I'm sure people would be curious about, because this is a very niche field, what kind of job opportunities and compensation is available to somebody in something like this? Like, looking at right out of college and maybe right out of college, if you do a master's program and then kind of getting closer to the upper echelons, like where you're at.
Yeah. So, obviously this depends on where you are in the country as well. But you're usually going to start between 60 and 75,000 a year. as a new grad. And that depends on where you are. Because I know that there are new grad positions that are open in LA, which is stupidly expensive. And they're like almost at 90.
Okay.
And that's just like to barely get by there. So it really depends on where you are in the country. But generally, you're looking between 60 and 75,000 starting out.
Okay.
And I have friends of mine who can make all the way up to about 250 to 300,000 a year.
Wow.
Now, there are obviously outliers because they work for major health systems.
Okay.
But that's not uncommon to be, in a six-figure income easily. You don't even have to have a master's degree to get there. Usually a bachelor's degree or an associate degree with a lot of years of experience will get you there very quickly.
Okay.
We are a small community. There's not many of us in the world because actually it's a global credential.
Oh, okay.
And so I've worked in China and I worked remotely for Poland and Australia. So it kind of translates. And then of course for the federal government and for state governments. But you're looking at a big difference. I would say middle of the road, you're looking between 130 and 150.
Okay. So definitely a well compensating job. Now, is that something like, you're looking at 3 to 5 years in, you're about that, or 10 years in, or is this?
Well, I can give you my personal experience, which is very interestingly unique in that I went from a small consulting company and I was compensated very well for the small consulting company. But then I got hired by an international consulting company that works primarily with state and federal governments. And so I went from, about 90,000 in California. And I jumped into the low to mid with bonuses, like mid 6-figure income.
Okay.
In 2.5, 3 years.
Okay. So there's a lot of opportunity to grow fairly quickly if you're good at the job.
Yeah, if you apply yourself and if you actually put yourself out there, people are just looking for them. The profession as a whole is the average age in our association is 55. So they're aging out, which is the problem. Yeah. And so with that, they're hungry for people who are younger to come in and to want to be involved. I know, Clint, we've kind of talked about this before at just social gatherings, but I go and I speak at conferences, state conferences. So 2 years ago, I did 27 presentations for different states. I talk on, healthcare. I talk on social determinants of health. I talk on regulatory compliance. I talk on all these things, right? But if you are a younger person and you want to do these things, the best way to do that is just to get in and start offering to speak. All of a sudden, you're going to have job offers everywhere. They want somebody that they can train up, that they can put in their position that they trust and they know is good at their job.
Interesting. I find that an interesting fact about the age, like the average age, because that's one of the things that I was finding out recently about the accounting industry, which is even more terrifying. So the average age of an accountant right now, I believe, is 63 years old. And in the next 5 years, I think it was 65 or 70% of the accountants in the industry are aging out and retiring. And I was like, that's horrifying and great for my industry because I'm not going to have a lot of competition, but
yeah. You do one great thing a year and they'll be like, oh my word, that person is amazing. And you're like, yeah, well.
Yeah, exactly. Yeah. That's just what I do,
Yeah.
Yeah. But I wonder, I am curious to know that, because you say it's 55 for your industry, I'm curious how many industries are actually in that same boat, because a lot of these, boomers and even some of the older what is it, Gen X,
Yeah.
are starting to get to that age where they're starting to get to retirement age, and you know that there's nobody to replace them.
It's true. I just heard that not that this is the same thing, but I just heard that like ministries, so pastors and stuff, they're in the same boat, but they're estimating in the next 5 to 10 years they won't have enough pastors at all. So I was hearing one of the churches that I'm a part of say, we're actually trying to go to community speakers and only have regional paid pastors that already know theology so they can advise their communities.
I've actually seen that happening. It's crazy. I have a friend of mine that actually does that. He is not a ordained minister in any capacity, but he is the head of a church in this area. And he has like kind of what you're talking about, a regional pastor that he's the head pastor. I think it's 4 smaller churches in this area. And this is one, I mean, the church is so small. I think they have like 30 members at absolute tops. So really, it's hard to say that that's actually even a church, but they're the consistent members that go there. And so, I heard that and I was like, man, that's interesting that, the pastors are starting to age out, and how many of these other jobs that are largely in this boomer generation and even the older Gen X's are just aging out and not doing it anymore, Yeah. Because teachers are in the same kind of thing. I'm everything. I'm hearing that I saw a statistic about one of the colleges in our area that they used to have an average of like 70 or 80 teachers graduating every semester, and last semester they had 3.
Oh wow. Yeah. Now that is extreme.
Yeah. And I was like, well, maybe it was just an off semester, but I looked at the projected graduating class for the next semester, and I think it went up to like 8.
Yeah, there's a huge teacher shortage.
Can we really say we're surprised?
No, we can't.
It's such a hard job.
Ricky and I have had a lot of
teacher. As a former teacher, I can confirm it's. I don't want to go. No, I don't want to go back.
Here, and this is kind of where Ricky and I have had some conversations in the past of that. I really do think that the problem from an education perspective is that there has been so much emphasis on it's basically a babysitter. Like, let's just get them in there and they can watch my kids for me while I have to go to work, because things are not like they were in the 80s and 90s anymore, where one parent can afford to work and the other parent can stay at home and take care of the kids and do all that stuff. It just doesn't exist anymore.
It's more than that, though. Like, if it was just watching someone's kids who are, taken care of well and have had some, like, discipline and upbringing, that would be one thing. But the problem is that more and more, a lot of our school systems are actually doing the parenting and teaching the things that aren't being taught at home. Mm-hmm. And who wants to do that for someone else's kids, especially when you don't get the opportunity? Like, you're caught in a like a paradoxical situation where you're being a parent, but you can't be a parent at the same time.
Responsibility, but no authority.
Exactly. Your hands are legally tied.
Yeah.
And yet, if this kid's going to have any shot in life,
he really needs a crack across the face.
Yeah, you really need to give him a backhand around the damn mouth.
Yeah.
Well, that's still legal in Arkansas.
Yeah.
Man, what was I doing teaching other places? I should have been in Arkansas.
I tried to get you to come down here and be the dean down here for like 10 years, so I don't even want to hear it. You were just so set on sticking out in that left coast.
Oh, not anymore. So.
Yeah. Oh man. But yeah, it really is. I agree with you. And there's, I'm sure there's all kinds of variables that are going into why education is not a desirable field anymore. The compensation's just not there. The competition is really, it has been very, very high for such a long time. Now, maybe there's probably an aging out situation in that career field as well. Because if you look at the average age of teachers, there's probably going to be a lot of them retiring in the next few years, which, drives up supply, or supply goes down, demand goes up, you're going to get paid better. But, when there's 15 people applying for every teaching job that opens up, you're going to have a hard time, getting a better compensating position when that's the case. So,
yeah.
Well, so that actually is an interesting segue into my next question. So, with your experience, would you recommend somebody that somebody's graduating from college and they're asking you for advice? Would you say 100% this is worth going in and taking, but only if you get scholarships? So let's say that, you were able to work and get scholarships and you were graduating with no debt, or, I believe there was a law, there's a law being discussed. I don't know if it was passed at this point, but I believe it's supposed to be passed where federal student loans are being capped on careers that you cannot afford to pay back the loan.
Yes, I heard about that too. Okay, so I saw this question because you sent me the questions.
Oh, yes.
Great. And I thought about it, and so sure, if you get scholarships, that's fantastic. But I graduated with student loans, and I got the best advice ever. So I'm gonna give it to you as well, all your peoples. A very precious person to me said, Kristen, for 3 to 5 years after graduation from college, live like you're still a college student. Okay. Just be diligent. I was like, okay. He's like, don't go out. You get your new job. Don't go out and buy a new car. Just stick with the car you got. Don't go out and like, oh, I'm going to buy a house now, or I'm going to, move into my own apartment. Like if your parents will let you still live there. And my parents did because I was traveling so much, and that was wonderful. They also would have just let me live there. But he said, just any way you can be frugal for 3 to 5 years. And it worked. I paid off my student loans. I helped my husband pay off his student loans. And I would say, even if you have to take out student loans to get this degree, it will pay off. And I've led my brother down this path. So my brother has the same degree as I have.
Okay.
2 of my great friends have the same degree as I have that came after me. I know, right? Yeah. It has served my brother very well. It has served both of the people that I have recommended to go very well. And so I would say, even if you have to take out student loans, you can pay them back, and you can pay them back well.
Yeah.
You just have to be strategic. There are scholarships out there. There's a ton of scholarships out there. All of the state associations, the National Association, the International Association, they all offer scholarships, all of them.
Okay.
So they have the opportunity to look into those and get those to do it. So I had to think about this because I was like, oh, this is kind of a, you want to be frugal. And I do agree with having, students be frugal with taking out student loans because they can go buck wild with those.
Yeah.
But this is one of those professions, in my opinion, that, it'll be slow starting off, but even slow starting off, you're not making like $30,000 a year. You're coming out of the gate and you're able to really get into it, and it accelerates quickly. So
that is because it's kind of a niche field.
Yeah. Funny enough, I had someone tell me, probably, I think I'd been out of school for maybe 4 years. I had somebody tell me, I don't know what you do, so you can't make very much money. And I always thought that was like the exact opposite. I always thought, if I don't know what you do, you are like a unicorn and you probably make a ton of money, and I just don't know it. And this nurse said this to me and I just laughed. I couldn't even figure out like where she was coming from. And, now I'm like, well, I know what you do. I know that I make more money than you. It's one of those things, but
interesting. Okay, awesome. So definitely do it, even if it means taking out some loans. But I do think that's a great tip, because that was kind of one of the next questions that I was going to ask, and that is a great tip. Focus on knocking stuff out. I tried to do something similar. When I graduated, I did get a new car, but that's just because my previous car was like. It was coasting across the college graduation line, and so I had to get something. I didn't buy anything super ridiculous or anything like that, and so I tried to, which right after I graduated, I was doing tax seasons where I would be working 100 hours a week. Got really good overtime, so I get a good paycheck at the end of tax season. Like, okay. Every bit of it's going on student loans, and I which I was fortunate going into accounting. I got a lot of scholarships that are available specifically for accountants, and so the schools that I went to, I had about 85% of my tuition paid, just through scholarships. So that was awesome. But I think I graduated with about $22,000 in debt.
That's good.
Yeah, and so considering the fact that I was in school for approximately 7 years, and I only have a 4-year degree, so don't do a lot of math there. But it was mainly because I was doing all my CPA prep work, and that you're required to have at least 150 hours to even sit for the exam, and so that was one of the reasons I was like, well, I'm going to go ahead and do it while I'm here. And I changed schools 4 times. Yeah, 4 times, which was too many times, and so when I graduated, that I was like, hey, listen, I feel like I did pretty good to only have that much. So, but what you're talking about, live frugally and try to knock it out quickly, and you can do that if you still live like you're in college, or even like you did in high school, run everywhere, drink water
on your bike.
Yeah. Do the tips that we gave you in our episode a couple weeks ago, where don't buy anything, don't buy things, anywhere. Don't drive places. Gas is stupidly expensive. Fasting, it's really easy to save money on food when you don't eat.
This is true. Well, Clint, it is a hot tip. You said you graduated with 22,000 ish.
Yes.
So I went to 4 different schools as well. And I was in school for 10 years. That was for my bachelor's.
Now you have a master's, so you get a little bit of
yeah.
But even so at the end of that, I graduated with almost $60,000 in debt.
Okay.
And that was a focus. I can't remember how much my husband had, but then my brother had way more than that and has done very well at paying that off as well. And I mean, I know dentists that graduated with $500,000 in debt, and they're not looking at paying it back anytime soon, because they had to do residency and they had to do all these things, right? And so with my degree, with my profession, there's no lag time. There's no you get out and they're going to pay you like $40,000 to learn something for 5 years, like they do with dentists, doctors, depending on what you go into. So it was a very quick turnaround. So just to give you some examples of what I'm saying, like 60,000 isn't a ton, but in today's world, that could be a car, a very nice car.
Oh yeah.
I just think it's worth it for anyone that wants to do it.
Yeah. I definitely agree with that. And I think that's what a lot of people need to take into consideration when you're considering going into a career path is this, because it is an investment. I'm taking out a loan as an investment. What is the return on investment going to be? If it's not going to justify these loans, if I can't afford to make that payment, this is a bad decision.
Right.
And
you're betting on your future.
exactly.
And so you better make that solid bet.
And you better make sure that is a good bet, because the government ain't going to forgive that loan. They're going to take it to your grave.
Wanted to.
Yeah, exactly. Like, oh, I'll just file bankruptcy. No, you won't.
Yeah.
You can file bankruptcy and still have to make that payment.
Yeah.
You're still going to pay.
Yes.
And if you don't, we'll make your children pay.
It's insane.
Oh, man.
Yeah.
Yeah. Okay, well, this has been very informative, and this is really cool, because I was always kind of curious about more of the specifics, and I like learning about these aspects of people's jobs, because how often do you really get a chance to like sit down and like go into the deep aspects of what it is that you do and why you chose the degree that you did and things like that. There's a lot of knowledge and wisdom to be gleaned from why people end up on the paths that they go on. And so
yeah,
I don't know.
Not really a social setting kind of conversation.
Exactly.
So
yeah.
It's awesome. Yeah.
Yeah. Now I don't know if Ricky had any questions. He was supposed to have some questions, but
I asked a question.
well, that's true. He did.
Come on.
Yeah. So
I was too
anyway,
busy laughing at you, like not getting the
details right about
things
half
right.
of the
Yeah,
stuff
the
that I was
details right. That was
referencing.
great.
Yeah.
with this. That's awesome.
Oh man. Well,
I'm gonna really watch that part.
yeah. So that does lead us. We'll jump into our next segment, which is the hype train segment. So this is a new one for everybody out there. So I'm trying to bring a little bit of positivity, because I've realized as I've been reviewing and editing some of our previous episodes that I know for me personally, I have a tendency to focus on the negative in a lot of things. And, Mr. Dick does here too. So
We should just start calling it the rant-erific.
yeah, this is just a lot of ranting. And so I was like, okay, I want to start talking about this from a perspective of what am I looking forward to? And I had something very specific that I saw. So
Oh yeah.
I saw a trailer on YouTube, amazingly enough, from Patrick Fenna. I think is his name. Okay.
I feel like you're making this up.
Renna. Renna. I was close.
That a lot
The kid, he's the chubby kid from the Sandlot.
Oh yeah.
So I follow
You're
him
killing
on
me, Smalls.
Yes, you're killing me, Smalls.
Yeah.
That's him.
Yeah.
So I follow him on TikTok and his YouTube channel and stuff like that. Apparently, there's a YouTube special movie being put together that releases sometime in August, I believe, and it is a spiritual successor to The Sandlot, which is, one of the most nostalgic 90s baseball movies of all time. And it's essentially Patrick Renna and his the majority of the cast from The Sandlot as adults. They get asked to come in and coach a little league baseball team. And so it's them being the parents of the little kids that are playing baseball now. And so I saw that and I was like, this looks like it would be incredible and such a fun watch. And, I'm sure there's all the nostalgia in there as well. So I was like, that's going to be my hype this week is go check out whenever that comes out. I'm going to see if I can find when that comes out, because I was pretty stoked about that coming out. So
That'd be fun.
yeah.
I loved that movie.
It's such a great movie.
Yeah. So okay, it's called Dugout Dads. That's what it's called.
Dugout Dads.
Yes.
Okay.
I love it.
August 26th. Yeah, so put it on your calendars. It looks like it. And it also has Topanga Lawrence. I don't know why I can't think of her real name, but yeah, Topanga from Boy Meets World. She is the wife of Patrick Fenna or Renna. Why do I keep calling him Fenna?
I don't know, man. You just, man, you're on a roll.
Yeah,
tonight.
it's one of those days apparently. So yeah, that was my hype train for this week.
Oh,
Nice.
I like it. I like it. What is yours, Ricky?
Well, mine is a little more personal because I've just been obsessed for the last week and a half. And my wife got me a 3D printer for my birthday. And I was playing with it last week on the show. And I can't stop. It finishes printing something and I print something else. And some of it is just stupid stuff. Like I printed this, it's a stand for a tablet. I ran out of blue and it was like, you had to replace it. And I just shoved black in there instead. And just like, I just wanted to print it. I printed.
It looks kind of cool though.
Yeah, it does actually. If I'd had more blue, I would have done like
half and half,
like
or
layers. Yeah.
Yeah. Oh cool. Yeah.
I just printed all kinds of crap and just random stuff, and it's like, oh, this would be cool, and like, I'm so excited about like you see something and you're like, man, I wish I had just a thing for this, and so you go on the internet and you type, whatever this thing it is that you need. Like I printed a grommet for my drywall to run an Ethernet cable through one of the walls in my office here.
Nice.
You see the cable?
Oh yeah, yeah. Runs up the yeah.
So there's a grommet that I printed to go in the hole for the cable to run through, and then it's got this little locking mechanism.
Nice.
Wow, that's really impressive.
Yeah, and like what's really exciting? I'm really hyped about. I just found a design for the battery cover for my Samsung TV remotes because I have like 4 of those remotes and 2 of them are missing the battery covers and I have no idea where the hell they are.
Yes.
But now I can print my own.
I may have you print me some and send them to me because my children have decided that they're going to chew on everything. So all of our remotes just look like a dog has been gnawing on it.
I could print some teething toys too if you want.
I have teething toys for my 6-year-old.
I'm going to leave that one up to you and Anna. It sounds like a personal problem.
It is. It really is. I didn't realize that was a thing.
I'm really hyped about this 3D printer, and I honestly think that the modern family, no family or household should be without a 3D printer. I think it's as close to, like, in Star Trek, they have, like, what do they call those things? Where the captain goes, tea, Earl Grey hot, and it just, like, creates a cup of hot tea.
Oh, yes.
Synthesizer or something like that.
Yes.
Like this is sci-fi crap right here. I'm literally printing things into existence.
So it's worth it. It's worth it.
I printed a can koozie for my energy drinks with a working pop top lid. All I had to do was add a rubber band to it.
That's pretty cool.
Yeah, it's really freaking cool.
All right, you convinced me.
Yeah. I've wanted to get one for a while, but I just haven't pulled the trigger yet.
Honestly, it's super easy too, because like you think, oh, I gotta know how to do all this design. No, you don't. You go on the web or even in the app, like the Bamboo Lab app. I just type random thing, and like then there's like 20 different versions people have already put together, and you go, this looks like the best one for me, and print it. And if not, who cares? A kilogram of spool is $20.
Yeah,
you're not spending hardly any money.
There we go.
You pay quite a bit for the printer on the offset, but I think it pays for itself in the end.
Ricky, we live in America. I don't know how much a kilogram is.
2.2 pounds. 2.2 pounds.
Oh, okay. I thought that was 2.2 tons or something like that. So
no, I'm sorry. You're right. Freedom units, not commie units.
Yeah. Welcome to America.
Yeah, we don't speak that French surrender monkey crap.
Oh man, that's funny.
Well, my 10-year-old wants one really bad. I have really pushed it off.
Yeah.
And I'm like,
Honestly,
10 is a big year. Maybe he needs one. I don't know.
yeah, I think so. I mean, there's the variety of like printers out there is insane. Like you can get
Mm.
them very affordably, and they go on sales. My wife
Really?
is a deal, junkie. So
Yes.
she got mine on sale, which was nice because she stole my quarterly bonus for it, and she bought the printer and the automatic multicolor adapt kit for it, so I can print with 4 different colors simultaneously. Yeah, it's pretty
Oh.
cool. So it's
Okay.
called the AMS.
So
It's pretty
so
sweet.
from a budget perspective,
Mhm.
is it worth? Because I've looked at them a little bit. Now this is probably at least 2 years old information, so I'm sure they've evolved significantly in that amount of time.
You're completely out of date there.
What kind of budget are you looking for, like to get into it, but not like blow the roof off of your budget?
I mean, like, I'm just going to speak in bamboo because that's what I have, and there are tons of other companies out there that sell them. Elegoo is a big one. Creality is also a big one.
You're just making up words
I know.
again.
I'm making up words. Hey, bamboo is a word. So,
And if you would like to sponsor us, Bamboo, we're taking on sponsorships.
that would be amazing. I mean, for a limited time, we're opening our sponsorships up, Bamboo.
Yeah. We're not desperate at all.
We'll consider it.
Yeah. We'll put you
Give us
in the
something
bottom
to
of the pile of this shelf has all of our applications for sponsorships right here.
So they're running a sale on the one that I have. It looks like it's probably about 50% off right now. Although I think my wife somehow got it cheaper than this, but it's under $600 for the printer.
Okay.
Oh, okay.
And the AMS, which it's actually a pretty darn good deal. If you just bought the machine by itself, it costs just about $400.
Okay.
And like if you go on Amazon and you look for filament, which is what, and that's a whole nother rabbit hole too, because the different types of materials that you can use are literally endless.
Really?
If I got the right material, I could print my own shoes.
Really?
Yes.
Can you do one of those 3D printed basketballs that like don't have any air in them?
Yeah, with TPU in particular. TPU is like a flexible filament, kind of like I think it's kind of like a silicone, but it's flexible. TPU, I think I can do.
That's the symbol, universal symbol for flexible.
Yeah, I guess I can flex. Anyway, yes, TPU is like a flexible filament that you can print things, and I have seen videos of people printing their own shoes. The one guy printed his own running shoes to run in, and I was like, running sucks, but okay, I guess you could print shoes. Clint, you'd like it.
Yeah. I'm just gonna go buy my shoes.
Yeah, that's what I do. I mean, I buy all my shoes off Amazon, for super cheap.
Yeah.
Witten, please sponsor us.
Witten, please.
Sponsor us.
Please again, please. I will put all of your shoes on my shelf.
I have an entire shelf of their shoes now. But yeah, there's tons of different, like you can print stuff that's very hard and durable. The really basic stuff, which I use, is called PLA, and PLA is kind of like your basic, like this is what you use when you're getting into it, and it works well for a lot of things around the house. It's not as heat resistant though, so taking PLA printed stuff outside can be, your results may vary depending on the weather, but they have other materials that will do a much better job of resisting the heat. The printer itself, like, I'm looking at on my app and tracking its progress, and the extruder, which is the piece that actually does the printing, so it heats up the filament and then it extrudes it. Extrudes, great word.
Word of the day.
It prints at 220 degrees Celsius, which hang on, let me translate that into freedom units for Clint.
Once again, this imperial crap.
Like, it's like 30 Celsius is like what, 86 or something like that.
Yeah,
Fahrenheit.
Clint, imperial is what we use for Fahrenheit anyway.
Listen, it's not imperial, it's American.
It's America.
America is an empire, but that's a conversation for a different time. Anyway, 220 degrees commie is 428 freedom.
Wow.
So hot.
Yeah.
You could say that, yeah. I mean, that's like an Arizona summer day, but yeah, basically.
Hey, listen, we're having a heat wave go through, and it was I think it was 99 yesterday. It was not.
What did you see today? Because I saw 105.
I think it was only like 94 was the highest. Well, heat index was probably closer to 105. But yeah, we went to Silver Dollar City last week on Monday, and it was horrible. I think it was the hottest day they've had all year. And the worst part was after we rode the American Plunge, we went to ride the Mystic River. I hate calling it that because it was the Lost River for like 150 years. And so they was like, it's the Mystic River. No, you're dumb.
No, you're dumb.
But yeah, they're like, it's shut down. Wait, why? It's too hot.
Oh. But even that one, the line is like 2.5 to 3 hours long.
Oh man, yeah.
Insane.
Yeah, I just want to 3D print a shiv and stab. Stab.
But riddle me this.
I'll put you one.
Riddle me this though. Why do Arkansans and maybe others? Why do we always go to Silver Dollar City in the middle of the flippin' heat? It's like, it's the hottest day in the summer. We all should go. Why do we go then?
That is a really good question.
Or the fall or the winter? Why?
So
why?
I will add the caveat. This is the second time we've been. We did go back in May, and it was actually pretty amazing. I think it was about 85. That's 85 to 90 is very very doable at Silver Dollar City. But once it gets to 99 plus, we were on a dead sprint to the American Plunge. And I was telling Ricky this last week, the thing that just drives me nuts is they put all these stupid safety measures in place because people die and all this other stuff. And, you go down the American Plunge and they've got a rail that keeps you from going like that high in the water. So it just splashes a little bit out instead of this torrential tidal wave that goes over the whole front of your boat, which is what used to happen. And so it's just infuriating, where's the rush?
Looking like I was thrown in the lake. It was ridiculous.
Yeah.
I don't know.
But we did go to the little, the part where they have the boats that you can sit in that have the crank squirt guns. Of course, my dad got into a war with another family, apparently, and just ran around to each station that had guns and was squirting the kid right in the mouth. And he looked like he'd literally been thrown out of the boat, even though he didn't get in it.
But he felt good.
Oh yeah, for sure. At least for about 10 minutes, and then all that water gets hot, and then you're just sticky. Ugh. Yeah.
There's another sponsorship. You get Silver Dollar City.
Yeah, Silver Dollar City. I made you a song.
Sponsor us during the fall and spring, not during the summer.
Yeah, exactly. Yes, exactly. So yeah. Anyway, okay. Well, we talked about Ricky's hype of the 3D printer. I think that's a great one. So let's jump over to Kristen. What's your hype train?
Okay. So this week I'm super excited because I've been working on an app for someone to be able to get advice and help for healthcare questions. So a patient advocate, if you will. Think of Uber for healthcare questions.
Okay.
Kind of.
I love that concept.
Thank you. because there's so many questions out there. Anyways, my app developer just sent me back and said he owes me the app, and so I should be able to review it soon, so I could start pushing it out to people and have them assess it. So I am just super excited to see what he came up with. I gave him my logo, I gave him my premise and my idea, and he was like, "Oh, I can work with this." So,
awesome.
So yeah, I mean, it's all about work, not about play. I want a 3D printer, and I'd love to see that movie.
Oh,
so
yeah,
I think I'm going to see the movie and
got
get
you
a 3D
hyped.
printer at some point.
Yeah. But hey, no, listen, this hype train is about what you're excited about. If it's work, go for it,
So yeah, I'm that weirdo though. I don't think I shut off very well. So work is always something exciting.
It really is interesting to me. So I've talked to Ricky a lot about this over the last, because we've been doing this podcast for like 8 months now, 9 months. We started in October, and we've talked. Actually, the last episode that we did, we talked a lot about healthcare and things like that, and we were talking about the gaps in healthcare right now, because it seems like a lot of people are they're having to go to 5 or 6 different doctors to get any information about what's wrong with them. I had right after I graduated from college, so around 2014, 2015, I developed a cough. Like just out of nowhere, and I could not stop coughing. Like this was like 7 months straight of just hacking all day, every day. I went to 3 different doctors asking what was going on. They never could give me any kind of idea about what it was. And I did every kind of WebMD search I could do and all this other stuff. Nothing. No idea. They actually thought I might have a heart condition, which, terrified me, because I was I was just barely 30 years old. They're telling me I've developed a heart condition, or I have a heart condition because of all the coughing, because that constant compression on your chest, it can cause heart palpitations. And so they're like, "Oh yeah, we've got to get you in for a heart cath and an echocardiogram and all this other stuff." And I was like, "Okay, well, let's start with an echocardiogram and not cut me open yet or anything like that." And I get the echo. She's like, I'm not normally allowed to say this, but you have one of the healthiest hearts I've ever seen. And she's like, "Do you run?" I was like, "Yeah, I used to run like 4 or 5 miles a day."
No.
I still run frequently. I haven't, in the past few years, but I'm trying to get back into it. But so she's like, "Well, you don't have a heart issue, so it's kind of weird. We don't typically, have people like you come in for an echocardiogram." And so I get that back to the doctor, and they're like, "Yeah, so we don't know what's wrong with you." I'm like, "Okay, great. Well, I'm glad you just shaved a few years off of my life, because I had to have an echo and you said my heart was stopping." And so anyway, randomly, I had one of those metal Yeti, like 32-ounce cups. I was trying to get healthier at this time. I was trying to lose weight. Tax season had just gotten away from me, and all I did was eat McDonald's and Subway. So I think I gained like 35 pounds in a matter of like 6 months. And so I was like, I'm done with this. I've got to fix this. So I was like, I'm cutting out soda. I'm drinking water, and I'm going to start eating healthy. Well, I just happened to I was actually sitting at home. I took a drink of my drink. I had just filled it up. It was water from my tap and ice. Took a drink and immediately started coughing. And I was like, "What's going on here? Maybe there's some kind of correlation here." So I get on Google, because AI didn't exist at that time, and get on Google and say, "Hey, can water cause you to start coughing?" And it says, the first thing that pops up, excessive amounts of chlorine in drinking tap water can cause you to develop extreme asthma-like symptoms. I stopped drinking tap water, and within a week, the cough was gone. Completely gone.
Wow.
And so I'm just like, I went to 10 different doctor's appointments trying to figure out what this was, and how would they have known to ask about water? But, you know, it's kind of like what you're talking about with an app that, you know, I can just start journaling with and say, hey, this is what I did today. This is what I did different. You know, give me some options to at least look at, because the doctors were like, yeah, we don't know. You just got a cough. Here, take this cough. You know, they gave me those. They had those little cough pearls, you know, that are supposed to suppress your cough. They didn't do anything for me, but, you know, it was because I had chlorine-induced asthma.
That's funny. I have exercise-induced asthma, so I know what you feel like.
Okay. Yeah. Not fun at all.
No. Yeah. So the app is basically to help people understand healthcare, like interpret what doctors say, because it is another language. You know, help with their insurance, help to understand why you're paying your premium and why they're asking you to pay your copay when you come on site. To help you, you know, with Medicare and Medicaid and all of those things, so that more people can be their own advocate.
Yeah. So. Now, do you ever in your career, like in your current job, do you ever work with smaller direct pay doctors? So like the ones that have like the subscription model where they're like, yeah, you just pay me $60 a month and I don't deal with insurance at all.
Yeah, so we can. The thing with a lot of those doctors, so for example, like aesthetics providers, they don't tend to take insurance either.
Okay.
And so if you're not taking federal money, then you're not held to federal regulation and federal things. So it's on them to now they're held to state, like privacy rules and things like that. But there's certain things they're not held to. So they call us less often, because most of the time they're like, we've got it.
Yeah.
But yeah, we can help them. All sizes are welcome.
Okay. Interesting.
Yep.
Nice.
Yeah.
Okay.
So yeah.
Well, good luck with that. That's a really cool idea. I love the idea. So hopefully that is apparently Ricky is just drifting.
He's like, I gotta go. I gotta get my 3D printed thing.
It is a 3D printed thing, isn't it? What did it just finish?
What is that?
Oh, it's the remote back. That's awesome. Does it just like ding like a microwave, or?
No, it sent me a notification on my phone.
Okay. Well, it's more sophisticated, I guess.
And mine has a camera in it, so I can watch it.
Watch it?
Really?
Yeah. See if it'll bring it up. It'll show me the inside of my. Yep, there's the inside of my.
Wow.
Print bed.
That's pretty cool.
That is cool.
I can be at work and I can tell something to start printing, and then I can watch it while I'm work. Obviously, I work.
Any of Ricky's employers that watch this podcast, Ricky does not do this all the time. He works.
All of our viewer.
All of our viewer.
I promise I'm working.
Yeah.
Oh, this is not the right size.
Oh.
Well, just cram it in there a little harder.
Yeah, just. It's either I need to scale it, or I need a different. Because there's more than one of these battery remote covers.
Of course.
I may have gotten the wrong one. But you know what? This probably costs all of like 20 cents.
It's going to add up.
He's like, I don't care.
Yeah, sure, it does. It does, but...
Well, can you just break off the top?
Break off your top.
Just tape...
I feel like that's such a finance person thing to say.
Right?
Can you just duct tape it on there?
There's literally not even close to the same size.
just shave it off.
Yeah, just
get a file.
Yeah.
This is the real one, okay? And this is what printed. They're not even remotely the same.
That is much bigger.
So we have like 4 or 5 of these remotes.
Of course.
And so I was just like, okay, I'll test on this one. Like, There's the original back, right?
You know, if I was making a recommendation to Samsung, it's you need to figure out the whole remote thing. We just got 2 new TCL, well, not just, but just in the last year, we got 2 TCL TVs, and their remotes are so much better than the Samsungs. It's incredible to me.
Samsung remotes are crap.
Yeah.
Like, I think they make pretty good TVs, but their remotes are not awesome.
Yeah. Yeah. Well, that brings us to our final segment, hopefully.
What are you
So we're going to do our going deep segment.
No faith in
No faith. So we're going to do our going deep segment with Mr. Dick here. So what's our going deep segment about this week, Dick?
I have no idea.
Are you shit?
You know, I've been busy.
3D printing things.
Yeah, I've been printing the crap out of everything. And you know what? I think 3D printing is. I would even say it's a net good thing. You know, it's very creative. Mm-hmm. It's really gotten me excited to do some of these really cool like creations. Start printing toys for the kids, like fidget toys, so they have something during church. My son is obsessed with Minecraft, like every 9 or 10-year-old is, and so I've started printing him some stuff, Minecraft themed and Hello Kitty themed for my daughter, of course, and I printed things for my wife. It has been literally an obsession. And even though it is, what?
You're so generous.
I know, right? I'm so generous.
Maybe you should print a going deep segment generator.
It's the least I can do for the money that my wife took from me to spend on buying this 3D printer.
It's very sweet.
It is, yeah.
And but therein lies the trap, right? Because even this nice and often very like positive thing definitely absorbs a lot of my time and energy, and you know, there's a lot of things out there worth putting energy into them, but a balance is of course paramount.
There it is.
Look, I fit it in.
I admire your go-getiveness there to just get that thing crammed in.
Yeah.
Good job.
Man, that's a low-hanging fruit there. I'm gonna skip.
Oh man.
You know, a good wholesome things, creative things are awesome, and it's been really nice to have something that I can do to create outside of work. I miss the school I worked at previously had an amazing wood shop, and I love woodworking, and I just don't have that opportunity. So this scratches an itch that I've not been able to reach for a while.
Yeah,
and it's really exciting, but I still have to temper it. Like, I can't be sitting there on Maker World scrolling designs all day while I'm supposed to be working, because then if I lose my job, I can't pay for more filament. Then I wouldn't be able to print anymore. That would suck.
Yep.
Or we'll send my kids to school. At the beginning of every call we do, all I hear is him swearing at his headset. He can never get it to work.
And we're back. So for some reason, my computer just froze up, and I'm having to have Ricky recap what he was just discussing. But yeah, you know, you're talking about 3D printing and balance.
I was talking about how it's good to have a hobby.
Oh yes,
that you know gives you enjoyment and like I was talking about how I used to do a lot of woodworking at the previous school I worked at, and I don't have that opportunity now.
Yes,
and this gives me some of that ability to do some of that kind of creative work. And it's really great because it gives me a positive outlet at home that, you know, I can do cool little projects for the kids, my wife, for myself, or for friends and family. I printed my mom a a watch stand that she can put actually I have one here. One of these magnetic chargers. And you just slide the cable in.
Yeah.
And then it holds the
Holds your
watch
phone up,
up at an angle.
Or the watch,
I mean, you can do that with phone. I mean, just like I was saying, like anything and everything, like things you didn't even know were things, they have prints for them. So, but it can get to be an obsession, and like I can't let it get in the way of work, because then if I get fired, I can't buy more filament to keep printing. Not to mention food for my kids and to pay for their tuition.
All that garbage, yeah.
That
kids got to learn and eat,
trivial stuff,
have houses, and beds, and clothing.
So everything in moderation, but definitely worth finding something that scratches that itch for you.
Definitely, that's a great going deep thought.
Now I gotta find a better battery cover for my remote. That one did not work.
Nice. Now back to the important things.
Exactly.
Yeah. Well, thank you very much for coming on, Kristen. This was definitely a fun and enjoyable interview, and we had Jordan on as our first interview, and I don't remember exactly what happened, but the video just did not record at all.
Oh yeah.
And so we got like 95% of the way through the podcast, and it was just blank screen. And I had no idea what happened, and we turned off the video and after we wrapped everything up, and I cussed and swore at this computer for probably 20 minutes because I had no idea what I did wrong. And so unfortunately I've figured out that I need to look at this screen, because that's where I have all of my confirmation that everything's being recorded and done correctly.
There you go.
Yeah. But
I'm glad you figured it out with Jordan and not me.
Yeah. But thank you very much for coming on and telling us about your career and
learned something very interesting today.
Yes.
Oh, thank you.
Yes.
Well, thank you for having me. It was really fun.
Yeah, and also best of luck with your app development and all that stuff. So yeah, that's the end of our episode for today. And in the next few weeks, hopefully we'll have our friend from Microsoft come on and do his interview, and
is he going to talk about AI too?
Probably. I feel like that's the whole shtick right now. Everybody's
from Microsoft. I got some pointed questions for him about frickin' Teams, man. I hate Teams.
I've given him to him too. Do it.
Yeah. Yeah. Oh man. I'm just gonna have him develop a better version of Teams. Like, hey, just forget this whole Microsoft thing. We're gonna just start another company and make the new Teams.
Right, they did. Yeah. It's called Zoom.
We're gonna call it Micro Hard.
Wait.
I don't.
Maybe after you then.
Yes. Anyway. Well, thank you very much. And everybody out there, just remember that today is a day, and go out there and
make it a great one.